What do the lab ranges mean for testosterone? So when someone gets tested, they get their full blood hormone panel done. Tell us about that.
Okay. Well, we take a look at ranges as a general guide of where someone is at. So lab ranges are very strange. We went over this earlier today, but in fact, we use two main labs. We use LabCorp and we use Quest. They both have a different range. However, 6 years ago, LabCorp's range was about 1190 down to 386. And in 2018, they revised that range to, I think it's about 930 and 236. So there was a big, or 268. I might be off by a couple numbers. But anyway, there was a significant downward adjustment. We feel that that's because more and more guys are suffering from low testosterone levels. As those guys who are unhealthy and have low levels of testosterone, their numbers are included in the average, there was a downward adjustment. The Quest range is 1100 to 250. So when you consider that from a numeric perspective, it's about a factor of 4.7 range from 250 all the way up to 1100. So that's a significant gap. What we can tell you anecdotally is that people who come to us and their levels are on the high side, they may be struggling with a little bit of extra weight, but very rarely are they in the obese. I don't think anyone has ever been in the obese category if they have a testosterone level toward the high side. And then the reverse of that is true. No one has come to us with a level under 300-400 and been, under 15% body fat. So people and their general health typically tend to correspond to their testosterone levels. We have a presentation that we show our clients. So let's take a look at the testosterone ranges. And we're going to see there was a study that was done back in 1996. There are not a lot of studies that are done that break out testosterone into ranges by age. But when you take a look at this chart, you can see that the highest level of testosterone came at the age between 25 and 30, which is when most great athletes typically reach their peak of athletic ability. So take a look at Michael Jordan, LeBron James. When were those guys winning slam dunk contests? If you take a look at soccer, Messi and Ronaldo, two of the greatest players of all time, they were at their peak athleticism in their mid-20s. They're still great players in their 30s, but they were better in their late 20s. Tiger Woods was winning a lot of Grand Slams in his late 20s. And then you take a look at tennis, Nadal, Djokovic. A lot of the tennis players are in their prime. So across most sports, guys tend to peak physically in their 25 to 30 year bracket. And when you take a look at the ranges, that happens to be when guys peak. And then they just continue to drop over time. So this sometimes will give us an idea of where someone falls on the spectrum of, within the range. But then outside of that range, it comes down to symptoms, right? So if a guy is struggling with weight loss, if they're struggling with energy levels, if they're struggling with libido, regardless of where their level is at, they probably are good candidates for testosterone, and that's based on the ADAM questionnaire. Another thing that we find that so many of our patients and clients say to us is that, let's say a guy goes to his general practitioner, he's a 52-year-old guy like me, he tests 450 and the range is 250 to 1100. A lot of times the general practitioner, we've heard this 1 million times, a general practitioner would say to them, 450, you're 52, what do you expect? And so, we sort of find that ironic from the perspective of that means that there's no help for the guy who's dragging with low energy, with low testosterone, who's 450, that he's just going to be dragging for the rest of his life. And we take the opposite approach here, which is we're going to try to figure out a way to get that person into the optimal zone so that they feel better. And as a result, they enjoy life, just like those other aspects we talked about in the previous question. So
yeah, this is something we have seen a lot. And upon working here and learning, you see that testosterone levels are very relative.
Yep.
So can you explain a little bit about the relativity of testosterone to each person?
Yeah. So what we find also, it's a good point. Some guys, a guy might come in and have a 600, and if he's in amazing shape and he was at 600, we never have this data point, but if they were 600 when they were younger, they would obviously still feel better. And we've run into the scenario where some guys actually haven't needed testosterone, but when we run their lab work, based on symptoms, their levels may come in middle of the road, but they feel great. They don't have any of the symptoms, but they might be low in a couple other areas, and so we address it that way. For the guys that need testosterone, we find it's a wide range from a numbers perspective and from a dosing perspective where each guy hits their optimal level. So I think the perfect example that I like to use is we have a guy who's exactly about my size. He's about 6 feet tall, 200 pounds. And he takes 60% of the dose that I take. He feels better a couple hundred points lower than I feel when I feel like I'm at my optimal level. And so you're taking two guys that have pretty similar lifestyles, that metabolize testosterone differently, and that, in fact, by the way, he had a high level or a higher level than his current level, and he felt like his libido was worse when it was too high. So we downward adjusted his dose and figured out that his optimal level, where he doesn't lose anything from a performance perspective, a cognitive perspective, and then it helped his libido. So yeah, it's relative to everyone. So we're constantly working with guys, trying to get them locked in on what level makes them feel the best.
Thank you for sharing that. Follow us. Subscribe.
Yeah, like us.
Notification, like us.
Smash the like button.
And let us know in the comments below if you have any questions or any topic you want us to delve into further.
Absolutely. This was a Rewind podcast, and we'll see you guys in the next episode.